Okay, so for ostomy care, you always want to assess a patient who has an ostomy in place. You always want to assess them to make sure that there's no leakage, there's no extra drainage around, going around the bag, that the tape or the adhesive strip is still stuck to the patient, that it's not loose. So you always want to assess. So for in this case, if I assess my patient and I notice that the barrier is loose, that it's not sticking anymore, we would want to remove it and get a new one. Most of the time, they can stay for 3 to 7 days, and you always want to make sure that you remove or you drain the pouch when it's 1/3 of the way full, just so it doesn't become heavy and it doesn't start pulling away. So for this case, we're going to say that we had to remove it, and we want to assess the site. We want to look at the stoma, make sure that it's not purple, that it's not there's no like pussy or purulent drainage coming from around the actual stoma site. But for this one, everything looks okay. So we're going to take some chlorhexidine wipes to clean away the gel that you use to put the ostomy in place. And so after we clean it, we have on gloves. Before we do all this, we put on our gloves and we come in and do all this. And then they're just clean gloves. They don't have to be sterile for this. But we removed it. We cleaned it with chlorhexidine wipes. We put tap water on it, take a washcloth and just pat it dry. And then we want to measure for a new one. So you always want to measure, make sure that it's 1/8 of an inch outside of the stoma site, so it doesn't occlude, that there's still blood flow, it can drain properly. So we measure, and when we figure out the right site, we can draw around on the ostomy, the barrier, and then cut a hole. So after we cut a hole in this, we want to apply our gel to it around the site. And then we would take this and put it in place. This one doesn't exactly fit, but in a normal setting, we would have one that does fit. And make sure that it's sticking, that it's completely stuck to the skin, that there's no, that it's, you don't want it to be too big, because if it's too big, then it'll cause skin breakdown, which is a problem. So you want to make sure that it's not too big and causing skin breakdown. So then we take our pouch and apply it to the stoma, and then we can take this and roll it up and burp the bag.